HealthKick is a project that was started in 2005 that looked at the concerns around healthcare and human resources in rural communities and looking to address those issues in a creative, innovative, and sustainable manner. We're looking to engage the youth through opportunities such as MedQuest Camp and rural work placements. Employers open their doors to our local youth to offer them experiences that perhaps at the post-secondary level they are engaged in learning skill sets that relate to careers in healthcare, as well as get a better idea of what it's like to practice at the careers that they're pursuing in a rural setting ultimately.
It was fantastic because I got to learn not only about medications, that type of thing, but I got to interact with patients, got to understand the process, how it works, but how prescriptions work, how the whole primary care works, especially in a rural setting. It is different because everybody's kind of on a first name basis. It's a really personal interaction, and it was really nice to kind of get to see that process happen and learn from being immersed in the field.
By having the summer placement through HealthKick Huron, it gave me the opportunity to get a foot in the door into a job, and then I was successful in getting a full-time job out of that placement.
You might as well go to the end. You might as well go right into Grand Bend. What do you think?
Well, that'd be all right. I like the beach.
The big benefits of the local delivery of training initiatives has been the ability for us to concentrate on those occupations that are in demand. And I think the real demand for that occupation, personal support workers is what I'm referring to, is quite often overlooked as a career area.
The homes and the home care, long-term care can always use more personal support workers. And as long as they keep bringing it into the rural settings the way that they have with HealthKick, then I'm sure we're going to continuously have personal support workers coming out, because it is something that a lot of people would enjoy doing and get great satisfaction from doing. And it's one of those jobs that you can go to work and you don't actually feel like you're really working. You just feel content at the end of the day.
HealthKick, I think, has a real important role to play in rural communities, especially because the philosophy of HealthKick is to take our own and grow the healthcare human resources that we require. And we know that there's going to be a desperate need of nurses and other healthcare professionals in our communities in order to be able to have the types of services that are going to be in demand with an aging population.
They can train here without leaving their homes and going away to school. So I think that's a really nice thing, because it's something you don't often get in a rural area, and that's one of the problems with being in a rural area, is just how isolated things can be.
It makes it easier for people to stay and not have to leave. That the jobs are there, you just have to have the education and training behind. So it keeps everybody.
It keeps you here. It keeps you home. Yeah. And this program offers balance in your life, which is what most adults crave. They like balance. And this program lets you create that in your life.
I'm a single mother with 2 boys and own a house in Clinton, and I could never have went to school full time and never could have, Seaforth was like a perfect location for me. There's no way I could have drove to London 5 days a week. This was just, it was reasonable, it was close by, it was local, it just fit in perfect with my lifestyle, and without it I wouldn't be a nurse, that's for sure.
So yeah, no, I definitely think HealthKick's an important program to keep going. It's really something that doesn't exist anywhere else in Canada, and I think it's very important for the future of healthcare in rural areas to have programs like this that exist.
Healthcare is really one of those areas of service to the community that really requires that personal touch, and people have to be able to see themselves in the occupation in order for them to feel that they are going to get out of it as much as they have to give. We've been able to offer the opportunity for people to really come to grips with who they are, what they want to do, and how they want to do it. And I think there is an excellent opportunity for us to continue this work in the future by being able to continue to follow the people who've been engaged and find out what is the ends to their stories.